business enterprises existing or wishing to come into the state, get into the economic platform, stability of that platform in terms of public health that are going to be impacted by this bill.
And he brought up a good question, and this was an actual discussion I had with Banner Hospital, and what is that unfunded mandate? That's exactly what it is. We talk about this all the time here at the legislature, is about these unfunded mandates. This is definitely an unfunded mandate to our hospitals. I mean, the amount of work that they're going to have to now obtain because of the language of this bill, the new responsibilities of this type of legislation is unknown. But that's definitely one of the questions that we want to bring up later on this afternoon. And we have to look at it from a broad respect as well, folks. I mean, this is not going to just hit the immigrant community. This is going to hit the non-immigrant community. Folks that are U.S. citizens who do have valid insurance, who are going to have an unfortunate burden now of having to make sure that they keep identification on them that they normally might not have. The fact is, I mean, I would venture out to say that myself and everyone behind us, we all have driver's license. We keep them in our wallet next to our money. But there's some folks out there that don't have that luxury. They don't have that type of element in their wallet. So how are they going to get medical care? And look at it from a bigger perspective. Look at where the state is going in terms of health care. Just recently in last year's budget, we denied 90 plus patients on transplants. We're now asking the federal government to cut 280,000 people off our state Medicaid system, and now we're adding a chilling effect and a burden on hospitals that would be unknown. And that's the big concern in regards to this piece of legislation and in other health care measures that we're dealing with here at the state of Arizona.
The national health care bill that passed, the conservatives said one of their arguments against it, trying to repeal it, is we need less government in the hospital. We don't want the government coming between you and your doctor. Isn't this bill saying that government?
Adding government. This is adding government to our medical professionals and between our patients. This is an added step of government. The level of bureaucracy that we're putting into our local hospitals and emergency rooms is unbelievable. The fact is now that instead of performing their medical specialties, these doctors are now becoming ICE agents, and that is the big concern that many medical professionals have across the state. The unintended consequences of this type of legislation is unknown, and it's scary.
Have the legislators looked at the potential lawsuits? For example, in San Diego, there was this guy that got shot accidentally. He didn't have any documentation with him. They took him to the UC hospital. The UC hospital refused to admit him because it was going to cost too much, so they sent him to Mercy Hospital. Mercy Hospital took care of the guy, but then it ended up the guy was born in the UC hospital, and he sued the heck out of the UC hospital. But now the state is opening itself for lawsuits because not everybody goes there, with documentation when they're like in a coma,
One of the questions that I received on Friday, I was talking to a couple of physicians, and they were asking that same question is, who's going to make that determination if it's an emergency, non-emergency situation? If you're being admitted into a hospital, you're being admitted because you need medical help. And regardless if it's an emergency or non-emergency, someone's going to have to make that determination. And I can almost guarantee you there's not a physician in any hospital is going to make that type of decision. If they're admitting you into a hospital, you need help and you need medical treatment. And in that case, they're emergencies and they're going to be admitted.
Steve, are the hospitals going to testify against or for this?
No, they are. I anticipate they'll be vigorously opposed to this bill. I've had many discussions over the last couple of days in regards to their position, and so far they've all come out in opposition to the actual bill. They do plan on testifying later on this afternoon, pretty much repeating some of the same concerns that folks have brought up so far today.
To what extent do you think, maybe the medical people can address that, to what extent will there be civil disobedience if this act passes on the basis of medical professionals?
If I may. My name is Tenacity Chadbourne. I'm an EMT and I'm a burn tech. I work at the Arizona Medical Center, Arizona Burn Center, American Medical Hospital. I'd like you to imagine something, and this will address your question quite well. Imagine that you're busy, it's afternoon, you're making some lunch, you've got a pot of pasta on the stove, you turn too quickly, your sleeve catches, your 3-year-old just came into the intersection of the kitchen and the hallway, and the pot splashes onto her. What do? She's screaming, she's in agony, she's in pain. You have to get her to a hospital now. Are her eyes okay? Will her skin be okay? What is this burn going to do to her future? Who's going to fix it? How do we take care of her pain? But wait, if you take her to the hospital, will you get deported? Is someone going to check? Do you stop and find your purse? Do you scramble for your paperwork? When somebody's hurt, we should never stop to question who they are or what they do. And in the ICU, in the emergency room where I work, if I meet you, nobody will recognize you because your hair will have been burned off, your clothes have been cut off, and you come to me off an ambulance or a helicopter. And you're lucky if you can say your name, but most of you wouldn't be able to. And we don't ever stop to question who you are or where you're from. We deal with your wounds and we take care of you as long as you need to be taken care of. It's not our place to ask who you are or what you do or what money you make. It's our job to take care of you. And that's the only question we have to ask. How do we do that best? Not where you're from or whether you're legal. I personally refuse to comply with any legislation that would have me ask anything about my patients other than how can I care for you best? My last name is Chadbourne, Tenacity Chadbourne. Thank you.
Just to speak to the issue of the cost of immigrant use in emergency rooms, the Foundation has done a lot of work on that particular issue and has some very specific statistics that are available on their website. If anyone's interested. And my other question was, I'm sorry, I don't know your name. I came in. I wanted to speak in front of the committee. I didn't realize there was a press conference going on. Has any consideration been given to how this will affect so many of our veterans, many of whom are having stress-related issues, many of whom are on the street and probably are not carrying their ID unless it's still a lockdown. So by casting such a wide net, you are just sweeping everybody in.
The unintended consequences, like I said, on this type of legislation is unsurmountable. I mean, you listen to these different scenarios and what can happen. Me personally, my birth certificate's in a safety deposit box. You know, it is secured. I haven't taken it out in actual years. But the idea that you're going to have to carry this type of documentation with you at all times, and the idea that everyone is going to have available this type of documentation is unbelievable. I mean, this type of legislation just has an impact that goes beyond the immigrant community. I mean, this is way past the immigrant community. You and I that have medical insurance couldn't be hit with this type of legislation that can prevent us from getting the medical treatment that we need, and that's some of the biggest concerns.
Can I address that as well, though? A lot of people have been asking about the risk for U.S. citizens or legal residents to somehow be harmed by this bill, and there's no question that if this passes, U.S. citizens and legal residents will be reported to ICE, maybe hassled, maybe inconvenienced by it. But I want to be very clear that we're not just worried about mistaken issues of mistaken immigration status. Even if we invented a magic wand tomorrow that could tell us with unquestionable certainty who was undocumented and who was documented, so there was no risk that a citizen would be harmed, we would still oppose this bill. The American Nurses Association has an official position statement saying that undocumented immigrants have a right to health care, and the American Nurses Association officially rejects any bill that will be a barrier to access for undocumented immigrants. People in our communities are our neighbors. We are nurses, we are doctors, we are EMTs. Our job is to care for you. The Border Patrol is always hiring. If we wanted to be Border Patrol agents, we could have hired on there. We chose not to because we want to provide care for sick people. That's the appropriate role of a medical professional. That is the duty of a medical professional. It's not a duty that we're willing to ignore.
just real quickly to actually close up, this particular piece of legislation would be heard later on this afternoon in this very room during our Judiciary Committee, 2 o'clock, I believe, 2 o'clock? 2 o'clock this afternoon. Arizona is much better than this, folks. I mean, the idea that we will deny people transplants, the idea that we would kick 280,000 people off our state Medicaid system, and now we are going to entertain a piece of legislation that will have a chilling effect across the entire state of Arizona when it comes to medical emergencies is unconscionable. Arizona is better than this, and we do not need this type of legislation here in the state Senate or in the state of Arizona. Thank you.